Hi boo, it's been a while. And yeah, I haven't been with you guys in a while. I haven't released a video in a second, but I'm back. And now I live in the city of gold. I've moved to Johannesburg. So at the end of December, I moved up here. I graduated on the 15th of December. Officially Dr. Lethukwenama. I'm gonna share like some graduation pictures with you guys very soon. And yeah, so I speak about Mara now because I'm in the city of gold, Gauteng, and I'm a working woman. I work in a hospital this side, and I can also drive home on weekends. So a lot of things are going thumbs up for me. I hope you've been well, and we have a lot to talk about and catch up on. Let's do it. So in this video, I'm going to be telling you about 6 things that I've been learning and that I've learned and seen and realized and yeah, just observed over the past 2.5 months as I've been a doctor. Yeah, I've been a doctor for 2 months and 21 days, free counting to be exact today. And I am working in Gauteng, which is very different to Western Cape. But we're gonna delve into that a bit later. So number 1, if you're in Gauteng, you already know what it's gonna be. You'll definitely guess it right. You don't get paid on time if you're an intern. We're all supposed to get paid at the end of January, as you know, usually normal people work, new interns for government. But Gauteng is very different. The Department of Health this side is very inefficient in many ways. And one of those ways is just that they don't pay interns in time. This is not the first or the second time that this is happening. So I was supposed to get paid at the end of the month and I didn't get paid. I got paid a week later after everyone else. And that was only my basic salary. And then a week after that, I got paid my overtime, which is really not nice. You know, as someone who's working for the first time, you know, recently graduated, you're excited to get your first salary and you want it as a full package. But unfortunately, we didn't get the luxury of that if you're a Gauteng intern, or most of us. Some people actually did get paid on time. I think with our group, our small group of interns at my hospital right now, only 3 people got paid on time, which doesn't make sense. And mind you, I am still one of the fortunate people. There were some people who had to work and didn't have posts. So the Gauteng Department of Health promised them that they will open posts for them, but they must just keep working. And obviously those people can't even get paid, no a week later, because there are no posts for them. And obviously there's no funding if there's no post. So I mean, that's just ridiculous. That's honestly ridiculous. A lot of us have just been students and we're moving mostly to different provinces, different cities. It's an entire new life that you're about to live. You need to buy things and things are expensive. I bought a bed, it's mine. I've never had to buy one before, you know, we've always lived in res. Microwaves are always supplied in res, kettles, a lot of appliances and things like that, which are quite expensive accumulatively, that you have to buy in January when you move to this new city. But Gauteng, bruh. So I can imagine how many people were living on debt, having to ask people for money to just live until they get their salaries. And that's not cool. So if you're working for Gauteng Department of Health and you have an influence when it comes to salaries and such things, please do better. Tell your people and your colleagues to do better. All right. Number 2. DQ sucks. So DQ stands for doctor's accommodation. Some people are lucky and some are not. And when it comes to DQ, I've been one of the unlucky ones. Honestly. When I got into DQ, it's a small house at the back of the hospital. It has 1, 2, 3, 4 rooms, a shared kitchen. There's no lounge. And then just an extra room with just the raggedy stuff that no one knows who they belong to. And yeah, a shared bathroom as well. I don't do well with shared bathrooms, first of all. I haven't had to share for the past 5 years, bruh. So anyway, that's an adjustment. Point is, the DQ sucks. The paint is falling off the walls. There's maintenance issues. The toilets are blocked. No one cleans the house. So there's so many battles that we've had to fight now in Jan. Yo, guys, the maintenance people, they see us, or they just see Dr. Mang Mang calling and they just know, okay, what's wrong now? But you know, things are a bit better. We fought our battles, fought the good fight, and some things have improved. The paint is still falling off the walls, but it's fine. Yeah, so DQ at my place isn't that good, hey? Some people really have nice DQs with nice views and ensuite bathrooms. So that's really nice and sexy, and I wish I could have that, but I don't. So yeah, so that's one thing. So when you're applying for a hospital, when you get into your cycle of applying, just ask around about the DQs. I mean, I was honestly very warned much in advance that, you know what, the DQs aren't great. But because I have my own plans, I decided, you know what, this year I'm going to stay in DQ and we'll see how life goes after this. Alrighty. So speaking of facilities in the hospital as well, ne? Yo guys, I'm not trying to compare Gauteng and Western Cape, but Gauteng is old school when it comes to certain things, hey? In the past 2.5 months that I've worked in, none of the wards have computers. So you know what that means, right? Yeah, interns have to do all the paperwork. You know, we call paper pushers as interns, especially in the tertiary hospitals. I'm in a secondary hospital and I get a lot of exposure and I get to do a lot of procedures, but I'm still a paper pusher because, mommy, you can't order any type of imaging online. You can't order x-rays, book x-rays, ultrasounds, CT scans, none of that. You can't do that on a systems basis. Hi, you can't check your bloods online. So you need data. You need data to check your data. You don't check data with data. You need data to check your patient's blood results. You need data for WhatsApp groups to communicate with your colleagues, to discuss patients. But man, and I actually think the government should actually be subsidizing us with the data. They should install Wi-Fi systems in all hospitals, you know. It only makes sense and we should have access to it. Given the amount of data we use, like you literally won't survive a call without data. You literally will not. So yeah, that sucks and the government should do better, once again. And beloved people, number 3, this job is not glamorous at all. This job is not glamorous. It is not glamorous. Yo, it's the furthest thing from glamorous, honestly. Yes, we see doctors as this esteemed profession. If your child is a doctor, it's an honor, you know, because it's one of the professions that our parents couldn't really go into back in the days because of apartheid South Africa. But guys, the things that we deal with, nah, it's not fancy. One of my first calls, a man came in. He was stabbed on the head with some unknown object, but it was sharp, I think. Yeah, it was sharp. It was a sharp object. And he comes in not on the day when he was hurt or injured, 5 days later. And he has this skull laceration. It's 3 centimeters deep and about 5 centimeters long. Yo guys, yo. And because it's 5 days later, it's full of maggots. Like a lot of creepy crawling maggots. So like this is the wound and then the maggots are filled into this, like, I don't know if you can see the palm of my hand properly. So the maggots are full here and some of them are coming out. And he has an afro, like maybe half of mine. So some of the maggots are coming out this side and then the afro is curly with really small curls. So they stuck inside. If we try flip them, I'm getting goosebumps. Oh. If you try flip them, they don't want to, you know, go away. So, and then some of them get onto your clothing. So luckily I was wearing an apron on top of my scrubs, but still, that wasn't nice. So I cleaned them out, you know, put some peroxide in and, you know, they started going out and then I had to flush it with saline. When I was done, so I'm cleaning out the rest of his hair, I'm checking all the things. And when I go into this one side of his fro, you know, you have to dig into a fro. There's another one. Deeper and longer with even more maggots, and now those maggots are going into the other wound that I just cleaned. So now it's like, so now I need to start all over again. So that was really traumatizing for me. I haven't had to deal with maggots before in medical school, and yeah, one of my first calls as an intern. There they are, waiting for me as a surgical intern on call to clean them out. Bruh, I don't want to do that again. I hope I won't ever have to do that again. Yo, yeah, man. Yeah, guys, if you're hurt, please go to hospital early. Like, my hair's itchy now because I'm feeling all these things on my skin and in my hair. Yeah, there's many other things that are non-glamorous that we deal with, and that is just one of them. Okay, so get yourself ready for some gruesome stuff. And then number 4, one thing I'm loving, one thing I'm really loving and enjoying about Gauteng, there is black excellence in medicine. Guys, there are black doctors everywhere. Literally competent, highly efficient black professionals that know what they're doing, that teach well, that treat you as a person. And for me, that is just mind-blowing. You know, I come from Stellenbosch, where a lot of girls that look like me with my skin and my hair aren't really recognized. You know, there was a doctor that we worked with, Clami and I. Clami is my friend, and we were clinical partners in varsity. So her name starts with a T and mine starts with an L. And the doctor used to call us T and L because she just wouldn't put in the effort to call us by our actual names, whereas our white colleagues were called by their names. And we were with these people for what, 4 to 5 weeks? Still no effort, you know. And then I get to Johannesburg, where a doctor calls me Lethukwenama or Letu in full and pronounces it well and respects it. You know, when they call me, I feel recognized, you know, and they speak to you, and sometimes in vernac when you're alone and you have decent conversations, and you know, you're noticed, you're recognized. Even in a ward round, you're called by name and asked a question, and like, yo, man, there's just a lot of mutual respect and understanding. For me, it's just so good just seeing a black woman in that position, being my consultant and speaking to me and recognizing me. Man, and she looks like me, she has hair like mine. I really wish that I had that in med school. I pray that if you're still in high school, whichever med school that you apply to does give you that experience, because I think it does a lot for you. It does so much for your growth, for where you see yourself in the profession in years to come, for what you decide to pursue after this. You're validated. Representation matters. We've been saying this again and again. And for the first time in my life in medicine, I'm seeing so much of it. I'm basking in black excellence right now. So I'm grateful. Another thing, when we get to number 5 now, is that, you know how we've had this conversation over the past few years about, you know, different medical schools, the UCT students, they're very good with their theory, you know, they're stellar. The Stellenbosch students are very good when it comes to practicals, and they do amazing in hospital and they thrive there. I haven't really seen that. It hasn't been very tangible for me or evident in any particular way. I've been working with a group of about 13 interns and, about the 13 interns, and we've been really good. We've all been working very well together, treating our patients efficiently. I haven't seen anyone lacking or slacking compared to the rest. Yeah, so I haven't seen that, you know, I haven't seen that thing that they always talk about, that, you know, when you get into practice, you'll realize that students from this university are like this university are like this. I'm obviously more informed about the Western Cape because I studied there, but I really haven't seen that. And I've been working with people from Bloom, SMU, Pretoria, Wits, KZN. I haven't met anyone from the Eastern Cape yet. But yeah, we've all been really competent. And if you don't know, you ask. If you need a hand, yeah, you get it, you know. So yeah, for me, it's been fine. I haven't seen any difference. If you're experiencing anything different in your space, let me know. Let me know how it is. And if you're feeling some kind of way that you didn't get enough training or exposure in this space, let me know as well, you know. Because I know when it comes to orthopedics, I can literally count the days, probably like 2 weeks maximum, if not, less than that, of orthopedics when I was still in medical school. So, when it gets to that rotation, I know that I'll need to grind and still learn a lot compared to my other colleagues, because, COVID ruined a lot of things, especially for us who graduated last year. So yeah, let me know how you're experiencing that in your space. And number 6, I think the final one for this video will be, I've learned that I know a whole lot more than I give myself credit for when it comes to medicine. Unfortunately, for a very long time in medical school, I did doubt myself. I think my confidence shot through and I got so much better and got the distinctions that I've been wanting and the marks that I've been wanting and knowing that I deserve, of which, it's another story for another day when you're a Stellenbosch Black student, is that, yeah, man, sometimes you doubt yourself. And you don't think that when I go out there and see patients and start being a doctor, and when they say doctor, you're the one that has to turn around. You're the one that is being called when they say doctor, and you think that you won't know what to do. You actually do. In most cases, you do. And if you don't, you ask. And I've been very comfortable with doing that, Excuse me, I've had really good seniors that I've been working with lately that when I'm in doubt, I tell them what I think, and they correct me. And that's such a good space to learn, because now the next time I'm faced with that situation, I know exactly what to do. And whether I had doubts about what my management was of that patient, now that's cleared up, whether it was right or wrong, or if there's a different way of doing it. And obviously sometimes people do things differently but end up with the same results. So, but yeah, man, we must give ourselves the benefit of the doubt. We must know that we spent a lot of time studying in medical school. We spent a lot of time in hospitals, a lot of time late at night, early in the mornings, depending on your schedule, working at this. And now you're literally seeing it in practice every single day. And you know more than you think you do. Sometimes you doubt yourself, but you really do. And there's this one procedure that I had to do on a patient, and there was no doctor there, senior, and I was there, and I literally called one of my seniors. I'm like, okay, I need to do this and this for the patient. I'm not sure how. He literally guided me through it on the phone. I did it on the patient, and that was so satisfying, So we'll be fine. We really are great doctors. We're there for our patients, and it works out. I can say that it does work out in the end. There is light at the end of that tunnel. Yeah. So, beloveds, that has literally been my 2.5 months of working in medicine. Yeah, I'm a doctor, and some days it's surreal. Some days, I answer the phone and I'm like, Dr. Lethukwenama, and I'm like, yeah, that's really me, and that's who they're looking for. Hi, can I speak to Dr. Lethukwenama? Hi, doctor, there's a patient waiting for. I'm like, yo, this is really my life now, So I'm very, very grateful. Thank you, Lord. I'm so, so grateful for that. And yeah, I'm excited to learn some more and see how we go ahead with internship. It's been a lot of up and downs. Definitely, it's not all just beautiful, fun, #elevator selfie. But yeah, it's a lot of personal and professional growth, and I'm excited to share more of my experiences with you. Please feel free to share yours with me down below. Tell me how med school is going. Tell me how being a doctor is going, how high school is going, how applications for med school are going, TikTok. And yeah, I'm excited to hear from you. So till next time, keep well, stay safe. Testing 1 2 3. I've got a new microphone. 1 2 3. Testing 1 2 3. You can edit there. Oh, okay. Yeah. I have so much to talk about, and yeah. Hydrate, kids. Drink lots of water.